Hey you guys, what's up? It's your host Christy B. Welcome back to What's the 504. How are you guys doing tonight? So I just wanted to come on here and discuss this particular situation with the coronavirus that really fucking bothers me. Okay, it has been reported that a 17-year-old died of what they believe to be the coronavirus because an urgent care facility refused to treat him because he didn't have insurance. So, where is the outrage with this? This is not acceptable. We are talking about a life or death situation here. This is the United States of America, and we have turned someone away for care simply because they don't have insurance. It'd be different if he came in like, ouch, I have a stomach ache. Ouch, I have a headache. No, this kid was in bad, bad shape upon arrival. How can you turn him away and not provide any type of care? At least give him some type of treatment and say, okay, we'll call an ambulance to take you to the county hospital. You know what I mean? Like, how do you just turn him away regardless of how bad off he was and just say, oh no, you need to go to a county hospital. We can't treat you because you don't have insurance. This is a life or death situation, and clearly he had to have stated what his symptoms were, what his problems were. So you guys know that those symptoms are linked to the coronavirus. Why wouldn't you fucking help him? Why wouldn't you help him? And then what pisses me off is the mayor had the audacity to fucking comment on the situation, but showed absolutely zero outrage for the fact that he was turned away and no one gave a fuck that he was dying. So I fought the mayor on that shit. Y'all need to hold a fucking urgent care facility, which I saw y'all didn't fucking name in the article that I read. Y'all need to hold that facility accountable and fine their asses or something for that. When it's a situation of life or death, that's like somebody stumbling in the door with fucking gunshot wounds and y'all say, sorry, we can't help you. You need to go to county hospital. You ain't got no insurance, bro. I can't help. No. This is a life and death situation. You guys need to fucking help. Your job is to save lives and to help people. So if somebody is in a dire situation where it's life or fucking death and you know that this virus causes severe breathing problems, why wouldn't you treat him? And then he's a minor on top of that. And you still wouldn't fucking see the boy because he didn't have insurance? You gotta be kidding me. You've got to be fucking kidding me. Let me go ahead and read this article. According to the New York Post, a 17-year-old dies of coronavirus was turned away for lacking insurance. Okay, let's start here. A Los Angeles teen who tested positive, he had already been tested, who tested positive for the coronavirus died of septic shock after being turned away from an urgent care facility because he didn't have health insurance. So this is a different article I'm reading. I read a separate article and it didn't mention that. Okay, while the 17-year-old's positive COVID-19 test didn't arrive until after his death, okay, so this is correct then, they didn't test him. Residents of the LA neighborhood of Lancaster are outraged, as they should be. Lancaster Mayor R. Rex Parrish told the Daily Mail the teen was healthy and had no pre-existing conditions before his death. Parrish said the boy was turned away from the urgent care facility despite having respiratory issues because he didn't have insurance and was told to go to a public hospital instead. Despite the fact that y'all motherfuckers saw he had respiratory issues and couldn't breathe. You couldn't fucking help him. Shame on you. What is the name of this hospital? Because I will blast their asses all over the goddamn internet. The boy went into cardiac arrest en route to Antelope Valley Hospital. The hospital was able to revive him and keep him alive for about 6 hours, but by the time he got there, it was too late, Parrish told the Mail. The Friday before he died, he was completely healthy, and by Wednesday, he was dead. Now, I'm going to see if they're going to mention it in this article, because I read it on another news notification, and it said that the boy went into fucking cardiac arrest on the way to the hospital. Cardiac arrest. The boy's father is an Uber driver, and he had several other members of the family have also tested. Oh my God. The boy's father is an Uber driver, and he and several other members of his family have also tested positive for COVID-19. Members of a family who claim to be close to the teen say they too have tested positive for the virus. Wow. Damn it. Health officials in Los Angeles County announced this week that the teenager had died of coronavirus, which the fucking urgent care people knew that already. They knew when he came in that door that that's what the fuck he had. Just hours after health officials in LA County announced the boy had died from the coronavirus, health officials said there may be excuse me, an alternate explanation and that his death would be excuse me, an alternate explanation. What is the fucking alternate explanation? He's already tested positive. His entire family, obviously, that he lives with has tested positive. What is the alternate explanation here? Explain that to me. I'm not understanding. And that's where the article ends. Again, the mayor didn't say shit about this being inhumane, that they turned this boy around and sent him away, even though they knew he had respiratory issues and he was in a dire situation. Yeah, Mayor Rex Paris, shame on you for allowing this to fucking happen in your city and you not saying shit about it. Shame on you for not coming down on this urgent care facility and letting this fucking boy die when they could have possibly helped him. At least helped him somewhat until he could have gotten to an emergency instead of not fucking giving the boy no treatment at all. Man, y'all gotta stop with this. This is inhumane. I bet you what, had that been a dog and respiratory failure and the dog had been taken to a facility for pet care, I bet they wouldn't have fucking denied that dog with no insurance. I bet they would have treated that dog. I bet they would have treated that fucking dog. This stuff pisses me off. Pisses me off. I definitely wanted to touch on that, you guys. I also wanted to mention that New Orleans is having a hard time right now with this coronavirus, and I am born and raised in New Orleans, so I already know that the healthcare there is not great. Okay, for kids, it's great. We got the children's hospital, very good. For adults, no. No, the healthcare is very mediocre when it comes to adult care. Very mediocre. And so, this really bothers me that so many people are being affected by this. So many people are being affected by this. I'm trying to find the information on New Orleans, you guys. But I know that New Orleans is having a really rough time right now. It's not looking good. Okay. The Louisiana Health Department of New Orleans is concerned about the numbers. They show New Orleans and Jefferson Parish with the highest coronavirus death rates in the country. In Orleans Parish, that's 14.6 COVID-19 deaths for every 100,000 residents and 5.5 for Jefferson Parish, both for every, no, it doesn't say for every, parish. Both areas have significantly higher death rates than other areas of the nation. King County, which is Seattle, Washington, has 4.8 deaths for every 100 residents, and in New York City, it's 4.4. We know that we have a lot of disparity across our community. In any emergency, anyone vulnerable will fare worse. We are concerned because we have so much inequity in this community that we are at risk for the worst outcome, and we need to be cognizant of that. Joseph Cancer, MD, with the Louisiana Department of Health said, according to the state health department, a number of people in Louisiana who have died from COVID-19 had underlying health conditions. 41% had diabetes. What did it say? 41% had diabetes, 31% had chronic disease, kidney disease, and 28% were obese. Because of the demographics of our unhealthy population and in New Orleans, in particular, we do have a large number of patients who have these conditions, and that is what puts the patient in a higher risk category, even if they are of younger age, said James Diaz, MD, with LSU Health School of Public Health. You don't necessarily have to be older than 65. For example, you could be younger and have one of these coexisting medical conditions. Cancer says the main thing Louisiana can do is ensure access to acute health care. He says that why we are now seeing an unprecedented expansion of medical capacity in Louisiana, in which I do know that they have decided to use, I think, the Superdome as to facilitate some of the health care needs. Okay. The things that will make our outcomes even worse is if people can't get care in the hospital, if there are no beds available, or if there are no doctors or nurses available to treat them, Cancer said. The things that will make our outcomes even worse is if people can't get in a hospital. I'm repeating myself. He adds Louisiana's death rate number should serve as a warning. It's going to happen in many, many other cities. It's just happening first here, but other cities across the country need to know they're in just as much of a risk. And if we as a nation can't figure out how to get simple things like PPE and ventilators to the healthcare workers that need them to do their jobs, then we are going to be in big trouble. You think? Donald Trump. Speaking of him, I'm trying to understand why this man is even still in office. When a president can sit there and allow people to die because of his personal opinions about some of the governors over the states. So that is unacceptable, Donald Trump. Now, you have been doing some very fucked up shit, okay, prior to this. We all know that, the sexual harassment claims and everything else going on with you. But to simply say because you don't like the way you feel about a particular governor, or you don't like the way they express their opinion about you and the job that you're doing, a bad one, by the way, the job that you're doing, that you can, what the fuck is that? Excuse me. But the fact that you don't like that somebody gave an opinion about the horrible job you've done addressing this coronavirus, and you're so behind with the measures taken to try to get this under wraps, the fact that you just don't like somebody's opinion of you, or the fact that they're actually telling the truth, they're stating facts, that you would deny that state any type of federal assistance is beyond me. That should be illegal. That should be considered inhumane, or possibly, I don't know, maybe murder. Because if you're not supplying the states with what they need to help care for the patients that are in dire need of ventilators, what do you call that? You have the power to decide whether they can or cannot have access to ventilators for their patients who come into the ER that are in dire need of them. And so you're sitting there playing, oh, well, you have a better toy than I do, or, I don't like what you said about my toy because my toy is great and you think it's trash. So, I don't like you, so I'm just not going to give you access. I'm just going to tell, the medical supply companies not to send you shit. No, what state is that needs that? Oh, hell no, don't send them nothing, man. They said I was a bad president. We're not sending them nothing over there. I know they was telling the truth, but, we got to keep that on the wrap. I can't have them saying I'm a bad president publicly, even though I think I'm a wonderful president. I think I'm a wonderful president. Look at all the people that's dying. That's a great thing. That's just less people in the world, right? Less people in the world we got to worry about. You know what I'm saying? Let them die. I don't care. I just want my money, right? That's how that works. Yeah. So, people, we got to do everything we can to get this man out of office. Because that shit's just not going to fly. I'm really pissed off at the number of people that are dying. I'm pissed off about the fact that the nurses and the doctors are not being given the proper protective medical equipment that they need, protective gear that they're supposed to wear, the gowns, the masks, the gloves, everything. They need so much to be able to protect themselves while they're caring for the patients. And you sitting here on your high horse, trying to play favorites about what state you're going to give access to. That's inhumane. Like, what president fucking does that? I've never even heard of. I don't care how you feel personally about a person. Your job is to lead the country and to unite everyone. And you're sitting here, deciding about your personal fucking feelings. Who cares about your personal fucking feelings? There are people dying from a fucking virus. These people fighting for their lives. And you sitting up here doing shenanigans and playing 5-year-old fucking games? Give me a break. Give me a fucking break. I can go on and on about the horrible shit that's not being done, and the lack of response on this. But, I've done it on some of my other videos. So I'm gonna leave it where it's at tonight. But you guys, just please be mindful of what's going on. New Orleans, I hope that y'all are able to get the gear that you need. I know that the healthcare there is not great for adults. I know that there are a lot of people that don't have proper care. And so that's probably attributing to the larger deaths. I'm pretty sure of that. That's why there's a lot of people dying, because a lot of people don't have. And the crazy thing is, it's not that they may not have the insurance, but they're really just not getting the full care that they need. And this I know because I'm a resident of there, and so it's just like the care that they're getting is not sufficient. It's not sufficient. Not for the adults. Like I said, they do have wonderful care for the kids, but for the adults, I find, mm-mm, it's not. It's not. And I feel real bad. And then also with all of the restaurants being shut down in the French quarters and the bars and stuff, now they're having on top of that, they're having a rat problem. So they're having to put out rat traps and stuff because the rats are actually coming out into the open area in the streets, and there's like no food to munch on since the restaurants are closed. And then I know they're trying to keep it from going into the actual residential parts of the French Quarter where people live there and stuff. So, oh my God, I know you guys are under, a lot of pressure right now. But the mayor is doing a great job. I'm so happy to see a female for a change as a mayor of the city of New Orleans. I'm trying to think, when the hell was the last time there's been a female mayor? I mean, we had what, Ray Nagin, Mark Morial. I can't even remember from the last time there was an actual female mayor. I know there was a female governor, but. Anyway, you guys, so I'm gonna wrap that up here for tonight. But you guys, please do whatever you can to try to keep your family safe. I mean, I know me, it's a paranoid situation. Just going out to the store, and kids like to touch everything and stuff, and it's just so nerve-wracking. I'm just trying to walk around with the one damn bottle of hand sanitizer I have because all the stores are still like out. So and then you try to go online and buy shit, and they're out online, and then the stuff that they might have is saying, oh, in-store purchase only and all this BS. So it's just the whole process has been just, I think, rough for everybody at this point. So anyway, you guys have a good night. Again, thank you for checking out What's the 504. If you're new to the channel, please go ahead and subscribe, hit the thumbs up, click the likes, and hit the notification bell, whatever. And if you're returning, great. Thank you for returning to the channel. I am a new channel. So as you can see, I'm very passionate about the stuff that I speak on. So I report on trending stuff or things that I feel is important. This damn air freshener keeps spraying. And that I try to talk about things that are important. So, and I do celebrity news as well, but right now I have not been really covering any celebrity news because right now I really just don't give a fuck about what's going on with celebrities when there are people dying and fighting for their lives with the coronavirus. So, maybe I'll put a celebrity clip in there, in a couple of days or something like that, just to give you guys a break from the coronavirus stuff. But, I really just don't care. So, you guys have a good night. Thank you for checking out the channel. Again, I'm your host, Christy B. Peace.